Hey everybody, it's Dr. Ashley, pediatric emergency mom, coming to you on this Wednesday to talk about fluoride and two recent articles published by the New York Times. So, Dr. Karen Fody, who's a pediatrician in New Orleans, um, messaged me, I think it was earlier in the week, about these articles and wanted to talk about it. And so, what I'm going to do today is go through the two articles and the research study that was published by the National Institute of Health into JAMA. I'm going to go through those. And then later this week, Dr. Fody and I are going to do a live together on the perspective from a general pediatric standpoint. And then I'm also going to do a live with a friend, Dr. Strickland, who is a dentist. And so to get the perspective from a dental point of view. So let's dive into this because it is like a tremendous amount of information. And I'm basically going to be summarizing the research and these articles. The first thing I want to do is just talk about the title of these articles. So this is one from December 12th, 2024. From the New York Times, and it is The Benefits and Risks of Fluoride Explained. And the subtitle is A New Paper Examined the Findings from Dozens of Studies on Fluoride Exposure and Children's IQs. Okay, informative. This is the article, different author, published on January 8th. Study links high fluoride exposure to lower IQ in children. Subtitle: The results of a new federal analysis were drawn from studies conducted in other countries where drinking water contains more fluoride than in the United States. Okay, keep that in mind. So the first thing I'm going to do is go through that December article really quickly, and I am going to have to read off of notes because it really is a tremendous amount of information. So when I analyze these articles, I really take a deep dive into, for example, the research, the JAMA research, looking at what type of study it is, where did they get the information for this study, even looking at some of those original research papers. And so it takes a lot of time to then like condense the information as much as possible and then give it back to you guys in as objective way as possible. And so let's just talk about fluoride. So what is fluoride? Fluoride is a naturally occurring mineral. And we know that adequate amounts of fluoride can help the teeth by preventing cavities. And one of the way it does this is to make, it makes teeth stronger, and then it helps to prevent cavities by decreasing the amount of acid that bacteria is able to form on the teeth, because that acid damages enamel and then leads to cavities. One thing I do want to say about these studies is just something to consider. Higher levels of fluoride being linked to lower IQ in children, but also consider that chronic dental problems, multiple cavities, spending a lot of time in the dentist's office or with chronic pain, leads to lots of missed school and also school and cognitive impairments. So just keeping that in mind. So the first city, this was kind of interesting history that I didn't know, the first city to ever fluoridate their water, and this is interesting too, it's not fluorinate, it's fluoridate, which is a little mind trip up. And my brain so badly wants to spell fluoride FLOU, but it's UO. Anyway, I digress. So the first city to add fluorine to the water was Grand Rapids, Michigan in 1945. And they tracked the effects of doing this. And a decade later, they found that tooth decay had decreased by 60%. So that's like a really high percentage, right? So what is the big controversy with fluoride? The concern is that it has negative cognitive effects in young children. Okay, so in the US, the maximum legal limit that can be in the water is 4 milligrams per liter. okay? So that's the concentration, the maximal limit. What is in the US water, like generalized, what is in the US in the drinking water is 0.7 milligrams per liter. And that's defined by the US Public Health Service. So that being said, I'll just like skip really quickly to the results of the IQ study and all of the negative effects of increased fluoride on children's IQs were with levels that were higher than 1.5 milligrams per liter in the drinking water. So in general, so the US in general has half of that amount. We have 0.7 milligrams per liter. Okay, that being said, about 15% of public water systems, so giving water to about 20 million Americans, has more than 0.7 milligrams per liter. So you may be thinking like, wait, how is this possible? So even though it might be defined on a state level how much fluoride is in the drinking water, it's the addition is per my research based on city municipalities, and so they may not follow everything to the letter. And now that I'm talking through this, I'm actually going to get my husband to do a live. He's a geologist. He studied groundwater and hydrology, and he has written, like, I think the last two drinking water reports for the state of Louisiana. So we'll get him in on this too. So how do we sometimes end up with way more fluoride in the drinking water? That occurs when naturally occurring fluoride seeps in from soil and runoff rocks and these kind of things. Now, 15% of the US population gets their water from private wells. There's not regulation on these private wells like there are on municipal water sources. And so in 2020, it was found that 11% of these wells had a higher fluoride concentration, so more than 0.7 milligrams per liter. And so, again, like this really goes back to if you're concerned about your drinking water, finding out where your drinking water comes from, looking at your state's water report card. Every state has a water report card, and finding out how much fluoride is in your drinking water. One of the biggest concerns is with pregnant women and high fluoride exposure being related to, in a developing fetal brain, does that have negative cognitive impacts? And again, these are with levels higher than what we have in the United States. Now, there's tons of data on this topic on fluoride and children's IQs, and I do not have the time or the mental capacity to go through all of these papers. There were two papers that were quoted in this December New York Times article that were more recent that did not find a link between kids drinking fluoridated water and lower IQ. One of those was in 2023 out of Australia, and it was a pretty big sample size. So 2,682 kids. So it's a pretty big sample size. They found no inverse correlation. So they found, so inverse correlation being the higher the fluoride, the lower the IQ. They did not find a correlation between fluoride and IQ. And then there was another one in 2019 in Mexico that was the same, that did not find a link. So the problem with a lot of these studies is there is a significant amount of bias that's involved, and so it's hard to control for any kind of external factors. For example, where these studies are done, is it a cross section of the population? Are we looking at one section of the population? Like how strong is the data? It's not, and this is something to consider too. the talk is about adding fluoride to the water, right? But, or this has been the hot topic, but we also get fluoride from other places. So, kids, for example, can ingest a significant amount of fluoride if they're using adult toothpaste and they're swallowing it, or if they're globbing on even kids' toothpaste and they're swallowing it. So, this is why it's recommended, and we'll hear from our dental friend as well, that kids should only use like a pea-sized amount of toothpaste, and it should be a kid's toothpaste. So, if they're less than 6, the kids' toothpaste have 1,000 parts per million of fluoride, which is, I think is 1 milligram per liter. Um, don't quote me, sorry. Greater than 6 has a little bit more fluoride, 1,350 to 1,500 parts per million. And so the adult toothpaste have anywhere between 1,000 and 1,500 parts per million of fluoride. Other things that contain fluoride, tea, black tea, white tea, oolong tea, which I like all three of those. But again, everything in moderation. And soft drinks. So the average soft drink has the same amount of fluoride as drinking water. And this does vary based on where the soft drinks are manufactured, right? If they're manufactured in a city that has higher fluoride levels than another city, then there will be some variance there. For example, in general, Coke has the same, has 0.7 milligrams per liter of fluoride as drinking water. Dr. Pepper has more, it has 1 milligram per liter, and juice has 0.7, so just like drinking water. Countries worldwide, so not everyone fluoridates the drinking water. Some countries fluoridate other things. So there's fluoridated salt, and even fluoridated milk in certain countries. And one of the biggest concerns with like totally removing this from municipal water systems is that a lot of kids don't have easy access to dental care. And so giving them fluoride in this easy way in their drinking water does give them some dental protection. Okay, so that's kind of that first article from December. That's like that article summarized, like very generally summarized. You can read it, it's a bit long. The January article is shorter. Okay, so the January article, I want to preface. So the January article is based on this JAMA article, Fluoride Exposure and Children's IQ Scores, a Systematic Review and Meta-Analysis. So what does all that mean? Well, y'all know I like to draw pictures, and so I will post a picture. I can't do this. Post a picture of my breakdown. So this JAMA article did a meta-analysis. So a meta-analysis is when you combine data from multiple studies to try to draw one conclusion. So you can see how that there's a lot of error that can be involved, but it is nice to use lots of studies and combine them together in one area. And that's what they've done in this study. So they looked at 74 studies. None of these studies were done in the United States. The vast majority, so 45 of them were done in China, 12 in India, and I'll post the different countries. 64 of these studies were cross-sectional studies. So what does that mean? That means they observed data in a population group in one point in time. 10 were cohort studies where they studied a group of people who share a characteristic. And so the other thing that was interesting, in the JAMA article, it stated that when they analyzed these articles, they looked at the articles or the studies that had risk of being highly biased, ultimately meaning that data may not be as accurate as it could be because there are external biases contributing to some of the findings. So 52 of those studies were deemed high risk for bias, and 22 were deemed low risk for bias. So keeping all of that in mind, to this JAMA study and what they found. Okay, in a nutshell, this is what was extrapolated in this meta-analysis. For fluoride measured in water, and I'm reading directly from the JAMA article, associations remained inverse, okay? So as one thing goes up, the other thing goes down. When exposed groups were restricted to less than 4 milligrams per liter or less than 2 milligrams per liter, but not when restricted to less than 1.5 milligrams per liter. Okay, so in layman's terms, what they're saying is they saw an inverse ratio. So with higher fluoride levels, they saw lower IQ scores. And what were the ranges of those fluoride levels? So if they saw 4 milligrams per liter in the drinking water, some of these studies found a correlation to lower IQ. Or 2 milligrams per liter in the drinking water, they found a correlation with lower IQ. But in water that was restricted to less than 1.5 milligrams per liter, which, as recommended by the U.S. Public Health Service, and what is in the majority of U.S. drinking water, so this less than 1.5 milligrams per liter, there is no correlation to decreased IQ. So in our drinking water in the United States of 0.7 milligrams per liter, again, if your drinking water has 0.7 milligrams per liter, even up to 1.5 milligrams per liter, they did not find a correlation with lower IQ. Even in the studies where they did find a correlation with lower IQ, let me try to find, the decrease in IQ in the low risk of bias studies, so kind of in the better studies, the IQ score decreased with the higher levels of fluoride. The IQ score decreased by 1.14 points. This is a very small amount of an IQ drop. And I have a lot of questions. And when Dr. Foti and I talked on the phone, and so we'll cover a lot of this again. But when we talked on the phone, we had questions on a lot of these studies. How were these IQ tests obtained, right? So if you administer an IQ test to a child every day for 5 days, chances are they're not going to get the exact same score every time. There's going to be a little bit of variation. And so I know in at least one of these studies, because I did look at one of the 74 studies, and it was one of the low bias studies, their IQ was measured one time. So you could see how that might be an issue, right? The other thing, and this is interesting because when we, sorry, I have my notes. I need to be better with my notes here. When you look at that JAMA article that was published by the National Institute of Health, Environmental Health Sciences, this is in the discussion of that paper. I'm just going to read it out. There is an inverse association between fluoride exposure and IQ in some multi-country epidemiological literature. There is limited data and there is uncertainty in this relationship, so fluoride, IQ, when fluoride in drinking water alone is less than 1.5 milligrams per liter. My issue with this paper is that titles like this um, are very misleading, and even in the news, and Dr. Foti brought this up, a national news source, one of the anchors made a comment like, oh, and now kids' IQs are going down because of the fluoride in the water, and then just kind of left it at that. And so if you're a parent and this pops up on your social media, or you just happen to see this article or somebody shares it, or you're happening to watch this news source and you hear this, you, you I would panic, right? I would be very concerned. Wait, what does this mean? And so, and even for myself, who is used to reading research papers, used to looking through all of these things, like it took me a long time to get through all of this. And so the end kind of take home is, number one, find out where your water comes from and how much fluoride is in your water. And then number two, based on what's here, if that amount of fluoride is less than 1.5 milligrams per liter, there is no association with a decrease in IQ. Now, I did not get into the weeds about pregnant women in fluoride exposure or infants in fluoride exposure. This is a whole nother topic, and I think that Dr. Foti can help enlighten us a little bit on infants, especially if you're mixing formula, right? But at least for today, I mean, I've gone 20 minutes just talking about these two articles and this research paper. So that is fluoride in the drinking water in a nutshell. Please let me know if you have any questions, comments, and I hope you guys have a great day. And certainly, if you find any articles like this that make you worried, send them to me, and I'm happy to break them down. Thanks. Bye.